Good afternoon, and welcome to Senator Dan Quick, legislative candidate for District 35. Thank you, Senator Quick, for joining us for our virtual legislative candidate meetings. My name is Susan DeCamp, AARP Lead Volunteer Advocacy, and joining me today is Danny DeLong, also the AARP Lead Advocacy Volunteer, and Todd Stuvendek, Nebraska AARP State Director. Senator, we appreciate you taking the time to meet and discuss issues of importance to the 50-plus voter and their families in Nebraska. As a reminder, this meeting is being recorded and will be shared with AARP members across your district prior to the election. So Senator Quick, if you would like to start us off by giving us a little background about yourself and your campaign in about 5 minutes or less, that would be great. And once we've completed your opening statement, we'll move right into the questions. So go ahead.
All right. Well, thank you for having me. And as Susan said, I am State Senator Dan Quick. I represent District 35, which is most of Grand Island. So Senator Friesen kind of surrounds me. I'm in the donut hole. But I appreciate all of you inviting me to take part in this. As far as my background, I was a welder at the power plant for 28 years before I was elected into the legislature. And so I've always had a blue collar background. My wife Alice is a labor and delivery nurse here in Grand Island and has been doing that for 42 years. And we raised our family here. We moved here, we're both farm kids that moved to town. So we moved here in 1980, right before the tornadoes, and have raised our family here. As far as in the legislature, I serve on Natural Resources Committee currently, and also on Banking, Commerce, and Insurance Committee. And previously, I'd also served on General Affairs and Urban Affairs committees. In my time in the legislature, one of the things that we did come across that helped me understand how some of the facilities work, and really it was LR 296. It was brought forward by Senator Lynn Walls. But it looked more at the mental health facilities. But along that line, we also visited long-term care facilities. I was able to go along and help do a survey, or see what happens, not help do a survey, but be part of a survey where we would, they interviewed maybe some of the residents that lived there and looked at the facility to make sure that they were doing things the right way for the residents. As far as my campaign goes, you know, I started like last year. I started June of last year knocking doors, and we were able to knock doors up until the time that the virus hit. And from that point on, it has changed for me. We're doing more mailers, radio, those type of things, digital ads. And but one of the things that happened within our community with the virus, it's really, I think, has been beneficial for me, as we've had, we started out weekly COVID meetings, public health, United Way, other nonprofits, the Grand Island Chamber of Commerce, and CHI Hospital. And so taking part in that to hear about what's happening to people was really important. And for me, and like I told the people on those Zoom meetings, it was more about me learning from them so I could help my constituents. And so we would hear about people, especially some of the long-term care facilities, not being able to see family and friends for a while, and that's been really hard on people. So I sat on, also as part of that COVID, we had some COVID meeting, we also had some breakout sessions. So we had one on mental health, and we talked a lot about how do we get that help out for some of these, some of the residents of these long-term care facilities, so they can make sure that they're taking care of themselves and they don't feel alone. So I know they set up phone banking and things like that to try to help with some of that. So I think that was really important. It helped me a lot, and I could pass that information off or onto my constituents. So I don't know if I've gone past my 5 minutes, but I don't want to.
No, you're doing great. So thank you, Senator. And also, I appreciate the fact that you brought up the COVID situation and have given us a little background on what's being done in some of those areas. So thank you for that. We're going to move into the questions, and you've been provided the 3 questions in advance. The questions pertain to the age 50 plus in Nebraska, and we've allotted approximately 5 minutes for each question. So we'll begin with the first question, which pertains to helping people stay in their homes and communities. And Danny has the first question for you.
Hi, Senator. Just wanted to say I was a Grand Island resident for a couple of years. I enjoyed it. I lived there from 99 to mid 99 to mid 2001, and I lived in an upstairs apartment on downtown on North Wheeler, just like the 200 block of North Wheeler. And I loved living in Grand Island. If I had to move back, I'd be a happy guy. So I know your town. I like it. All right, here it is. The first question is livable communities. A livable community is one that is safe and secure, has housing that is affordable. In other words, no more than 30% of the income is spent on housing, has transportation options that allow individuals to travel by multiple means, has supportive community features and services for people of all ages, and thereby allowing people to remain in their communities as they age. Question for you, what steps will you take to ensure all Nebraskans have access to livable communities?
Well, thank you for the question. And, one of the things that I've taken part in since I've been a state senator, we've had some, they've had some meetings in Grand Island, and it's all across the board as far as helping people who maybe live in poverty, because there's elderly that live in poverty as well, and making sure we have that we can meet their transportation needs, and also making sure we can meet their housing needs. And so one of the things that I've done is this last year I had a bill, and actually I've had it for 3 years, and it was LB 424, which would expand land banks throughout the state of Nebraska. And it's a way to take some of these homes that are vacant, abandoned, and delinquent properties, revitalize them, and it becomes more affordable housing for people. So I think that would be a good way to create some affordable housing through that bill itself. Now, other than that, I think some of the things that we're working on in Grand Island, and I know public transportation has been, it's not quite where they want it to be. So I've been suggesting to people that we maybe need to look at the Tri-City areas, between Grand Island, Hastings, and Kearney, and get public transportation and get cooperation between those three communities to try to expand that public transportation so we could have better services for people. So in Grand Island right now, I think you can call for a shuttle ride to and from a doctor, but it's really by appointment only. And I know they do the best they can, and they have quite a few drivers, but I was hoping we could do more than that. So maybe we would have some designated routes for people so they would know when they could get on and get off of something for public transportation. I also know I've been contacted by constituents before on some issues they've had. I know one woman had called me about, she was in her home yet, but she had to shut all the heat off to every room except one because that's all she could afford. And I tried to direct her to services where she could get more help, to try to help her with that issue. I know that happens, and it's sad that it is happening, and we have to do a better job. I think for people to stay in their home, I think that is truly important. My dad is 85, my mom is 82. Now currently my mom's in a skilled care unit, but they both have lived on a farm their whole lives. So, and my dad's still out there. He's still got a few cows, which, he has for a hobby, keep him busy. But I think it's truly important that we can do the best job we can to keep people in their homes as long as we can. I think that's where they feel the most comfortable. I think that they've built their lives in those homes. And I know just from our home here, it's all about family. Our kids come home to see us, and that's what it is for them. This is the home they were raised in. So I think as the more we can do to help people understand and help guide them, get them education on meeting the needs that, if they need assistance of some kind, maybe get them in touch with a nonprofit to help. I know I've worked a lot with the Midlands Area Agency on Aging and trying to get services for people. And I don't know that a lot of people know about it. I didn't know about them before I was elected as a state senator. So how do we educate people to know who they can reach out to? So I think the Midlands Area Agency on Aging in this area, I know AARP would be able to help with those areas. I've reached out to Gina several times to supply me with some resources to help constituents. And so the more we can educate people on services that are out there, resources that are out there, I think the longer they can stay in their homes.
Yeah.
Great. Thank you so much, Senator. And I did just want to say, Grand Island is kind of a little bit ahead of the game on the livable communities for AARP because they have been designated as our very first livable community in the state. So congratulations and keep up the hard work on that. Okay, on to question number 2, which is my question. It is in regard to health, caregiving, and home and community-based care. So caregivers help persons living independently at home by providing assistance with activities such as bathing and dressing and performing medical and nursing tasks such as administering medication, etc. But caregivers often work with little or no training, and they provide the services with little or no pay sometimes. So mine is a 2-part question, actually. With that in mind, first, would you support helping caregivers with things such as paid leave, respite services, telehealth, and access to education and training? And secondly, how would you protect or expand paid services and supports, as well as financial security that allows more seniors to live independently in their homes and communities?
Okay, on that first question, yes, I would support all of those things. I can tell you just from my personal experience with my mom, we've had home health come in and a person who comes in to give her, to meet her bathing needs when she was at home yet. But I can tell you that it's vital to have people who have enough knowledge and know how to care for people. And so I think education for those people, making sure that they receive the proper pay, because you can't get good people to do that unless you pay them enough money. You can't, if they don't have sick leave when they're sick, that's another issue. I mean, they can't be there to take care of, if you've got the sick leave so you can stay home, then maybe you don't, I hate to say it this way, but maybe you don't pass a disease onto somebody else too as well. But I truly think that telehealth is going to come into play. I think that could be a big help for even people in their homes. I think expanding broadband is going to be necessary to accomplish that, especially in the rural areas. So I know we've been working on that in the legislature. And I think it goes back to education again as well, making sure people know the resources and where they can go to get that help. And I think providing education, and you probably all know better than me about what type of education there is in our college, our colleges for, I know there's RNs, and I know at the hospitals they have CNAs. I don't know what they have. I'll be honest with you, I don't know what they have, the people who come out to care for people in the homes, what kind of training they have, or qualifications. Maybe they've had CNA training or something like that. But I do think it's important to get them that training, and so they can better care for some of the residents in our facility or in their homes. You have to remind me the second part of the question.
Would be, you've talked a little bit about the paid services and supports. One of the supports, for example, would be the ADRCs, which you've already mentioned, the Area on Agency, or the Area Agency on Aging, and that is part of the ADRCs. So I know that you do support that. The financial security piece, those would be things such as, keeping the homestead exemption in place, the SNAP program, those types of things that offer financial security.
Yes, and I would support all of those, making sure that for people to be able to stay in their homes, they're going to have all those resources. And so I know there are people that that maybe have more in retirement funds than others. Some people are surviving just solely on Social Security, and really that's not enough. I know when I knocked doors the first time 4 years ago, I talked to several people who would tell me that I can't hardly make it on just Social Security alone. And maybe they'd had a spouse who had died too, and that led to even less income for them. I know that there's supposed to be some carryover from the spouse to from the husband to the wife, or wife to the husband on Social Security, but I still think it's still not enough. And I know I've heard a lot about drug costs, about pharmacy costs, and we've got to find a way that we can help with some of these prescription drugs for people. I know sitting on the Banking, Insurance, and Commerce Committee, we heard a lot about insulin and how expensive insulin was for people, and maybe what we could do in that area. So that is one important thing where I can help, maybe sitting on the Banking, Commerce, and Insurance Committee, is to, when we do have bills that come before that committee that would deal with, say, like insulin being included as part of or paying more towards insulin on your insurance, issues like that. So I know I support all of those things. I don't know what else I can add to that, but I do support helping in that area.
Great. Your answer was very thorough, so thank you so much, Senator. And then our third and final question is regarding nursing facility quality, and Todd Stuvendek has that question for you.
Thank you, Senator, for joining us today. Really appreciate it. My question is, an estimated 6,600 Nebraskans reside in one of the state's 211 nursing homes. By 2040, the University of Nebraska Omaha Centers for Public Affairs Research projects that number will more than double to 14,000 Nebraskans. According to Leading Age Nebraska, 33 Nebraska facilities closed between 2017 and 2019, unable to continue operations, and another 33 were in receivership as of the end of 2019. In 2020, another 15 facilities are anticipated to close because of staffing and funding issues make continued operations impossible. So my question is, how will you ensure that Nebraska residents receive quality nursing care, including ensuring an adequate nursing workforce, education and training, and proper reimbursement?
Well, I think first and foremost, we need to get the provider rates we need to get them higher. What I found out when I visited several nursing or long-term care facilities, I visited Bickford in the Grand Island area, I visited Good Samaritan Village, and then along with the LR296, we visited a facility over in Ashland. And I can tell you from hearing from the people who manage those, they could handle so many private pay and a certain percentage of Medicaid. And I know some of the facilities in Grand Island, when they have to take, and when it's mostly Medicaid, the services that they provide probably aren't, and it's not to their fault. I'm saying that there's just not enough funds for them to have the properly trained staff, to have enough staff, and when you're not able to provide the kind of pay you need, people are going to go to other jobs. And so we really need to make sure that we can increase those provider rates so we can actually help the residents, because they're the ones who are suffering. They're the ones who are hurt in the whole scheme of things when we don't increase those provider rates. It's not that, it's not about the facility. It is about the facility, but it's more about the residents. So I think that's one thing that I was able to pick up through the LR296, meeting with some of the people who actually manage the facilities, as well as talking with some of the residents. I've also had the opportunity to visit an independent living facility here in Grand Island and try to work with them on some issues. And getting to hear their stories it's really important. It's important for all of us to hear the stories of the people who actually live there. And then I haven't got to talk to a lot of the people who work in the facilities, but I know my wife had actually worked in a facility here in Grand Island part-time while she worked at the hospital. She knows a little bit about how the care is handled in some of the facilities. And so that kind of helps me some insight as well. But I think most importantly is increasing those provider rates so we can make sure we can maintain the proper care for our residents.
Great, thank you.
Okay, thank you, Senator. We're nearing the end of our meeting time, so we'd like to offer you the final few minutes for a closing statement. Any closing thoughts you want to put out there for your constituents?
Yeah, well, I just want to thank all of you for having me on and asking me these important questions. And I want everyone to know that I am working for my constituents in Grand Island, but I'm also working for all of Nebraskans, because every bill that we have that in front of the legislature affects every single Nebraskan. So I weigh my votes carefully. I want to make sure that I'm helping people. I don't want to put up barriers that are going to hurt people. And so I'm trying to make sure that I can do the best job I can to make sure that every Nebraskan can have the opportunity to succeed. So I've worked a lot, not just with the elder care and long-term care facilities, but also in juvenile justice. And I've always been a strong believer that if we can invest in our children earlier too, the earlier we can invest in our children, the better outcomes they'll have. So I'm looking at both ends of the spectrum, and I just care about people and I want to help them. So thank you for having me on, and I appreciate everything that you're doing.
Great, thank you so much. Thanks for taking the time to visit today with AARP, and we wish you the very best of luck in your campaign.
Yeah, thank you very much.
Senator.
Thank you.
Thank you, Senator. Thank you.